The traditional treatment option for uterine fibroids is hysterectomy. And basically what that means is a gynecologist will go in and remove the patient's uterus. There are many different ways to do a hysterectomy, some of them being very minimally invasive, including using a robotic instrument to take the uterus out. However, unfortunately, because fibroids usually are so large, oftentimes gynecologists still have to rely on making a traditional incision to open the abdomen and then remove the uterus. The main benefit of hysterectomy for the treatment of uterine fibroids is that it removes the uterus, and so the woman has no more menstrual cycles. The main downsides to hysterectomy is that oftentimes it does require an incision in the abdomen. Most women are in the hospital for several days, and recovery is typically up to 6 weeks. In addition, because the uterus is removed, the patient can no longer have children. For that reason, about 25 years ago, gynecologists started to try and have other surgical treatments to treat uterine fibroids that were less invasive and did not remove the uterus. The main goal of this was to preserve the woman's ability to have children. One of the main treatments that arose out of those efforts is called myomectomy. And myomectomy is considered by many to be a partial hysterectomy. And what that means is that the gynecologist will go in surgically and remove as many fibroids as they can get to and then put the uterus back together. The main benefit of myomectomy is that the patient keeps her uterus, and so she does have the chance to have children. In fact, if the fibroids are the cause of her infertility, it's thought that the myomectomy can even improve her chances to have children. The main disadvantages to myomectomy is that it carries all of the same surgical risks as hysterectomy, as well as the recovery time. Specifically, oftentimes it's done with an open incision. The patients are in the hospital for a couple days, and it also requires up to 6 weeks for recovery. The other main disadvantages of myomectomy is that it can only treat the fibroids that the surgeon can remove. Oftentimes, patient will have 10 to 20 fibroids, and the surgeon is unable to get all of the fibroids. This increases the chance that the treatment won't work. Lastly, a main drawback of myomectomy is that it does carry a risk of bleeding associated with the surgical procedure. For that reason, about 20 years ago, a gynecologist in France came up with the idea of performing an embolization of the uterine arteries prior to the surgical procedure. Embolization is basically a fancy word that means blocking off the blood vessels that supply the uterus.